Please start. Start. Doctor, please start.
Okay. Good afternoon, everyone. I hope I am audible to you. Am I audible? Should I start?
Yes, sir.
Okay. Should I start with the presentation directly or I'll introduce myself?
You can start, sir, directly.
Okay. So this is Dr. Bhavan Dolas. I am medical director of Dr. Agrawal Eye Hospital, Pimpri Chinchwad branch. I am practicing ophthalmologist, cataract and refractive surgeon from last 25 years. So today it's my pleasure to interact with you regarding refractive surgery, mainly LASIK. So most of you have question in your mind. So I don't want glasses and I can't tolerate contact lenses. So what is the solution? The solution is laser vision correction. In laser vision correction, there are many types like photorefractive keratectomy, then LASIK. LASIK is an acronym of laser assisted in situ keratomiliosis, then femtolasic, then SMILE. Then there are other procedures like intrastromal corneal implants, implantable phakic contact lenses, and cataract refractive surgery. LASIK is the most commonly performed laser eye surgery to treat myopia, that is nearsightedness, hyperopia, that is farsightedness, then astigmatism, then nowadays presbyopia, that is called as presbeyond also for near vision. Like other types of refractive surgery, the LASIK procedure reshapes the cornea to enable light entering the eye to be properly focused onto the retina for clearer vision. LASIK surgery is painless procedure and takes only about 15 minutes for both the eyes, and the result is improved vision without eyeglasses or without contact lenses. You can begin immediately after the procedure and vision usually continues to improve and stabilize over a few days. There is high success rate. It's a very safe procedure. Then your vision improves and recovery is very fast. It reduces the spectacle contact lens dependency, and usually it is done after 18 years of age. So before LASIK surgery, what evaluation is to be done? So your age should be more than 18 years. The shape and thickness of cornea we evaluate, then pupil size we evaluate, refractive errors, whether it is myopia, hyperopia, astigmatism or presbyopia, as well as any other eye conditions. The tear film on the surface of your eyes also will be evaluated, and a precautionary treatment may be recommended to reduce your risk of developing dry eyes after LASIK. So in evaluation, there are many different machineries for dry eye evaluation, then dry and dilated refraction. Full retina checkup is done. If there is any problem in the retina, so we do treat that first and then only we go ahead with the LASIK. The cessation of contact lens is required minimum for 1 week before doing procedure. And for this, we do evaluation of your corneal curvature with either pentacam, off scan, or corneal topography. Usually, it's an automated instrument called a corneal topographer, which is used to measure the curvature of front surface of your eye and create a map of your cornea. Nowadays, with wavefront technology associated with custom LASIK, you also are likely to undergo a wavefront analysis that sends light waves to the eyes to provide an even more precise map of aberrations affecting your vision. Then thorough dilated retinal checkup is done. Then we do optical coherence tomography sometimes if some retina problem is there. We check all peripheral retina because most of the times number is high. So in myopia, there are chances of some peripheral retinal breaks and all. So we treat that first and we do routine blood investigations also. So what are the contraindications for this procedure? If your cornea is irregular, like if you have conditions like keratoconus, so in that case we can't do LASIK. Then epithelial basement membrane disease. Then if your cornea is thin, if your cornea is less than 490 micrometer, then we can't do the LASIK. The cornea steeper than 48 diopter and flatter than 40 diopter. Then in very high myopes, usually LASIK can be done if the refractive error is more than 12 diopters. In that case, there are alternative options are also available. Then if your palpebral fissure is narrow and prominent brow, then corneal ectasias, the conditions like glaucoma, diabetic retinopathy, progressive retinal disease, or some herpes simplex keratitis. There are mainly broad, if you classify broadly types of LASIKs, the first one is PRK, then standardized LASIK, then femto LASIK, then SMILE, and then contour LASIK laser vision. So what is PRK? PRK is photorefractive keratectomy. If refractive errors are mild, that is up to 4 diopter, in that case we do PRK. In this case, corneal epithelium is abraded by spatula or alcohol. Laser energy is applied over the exposed stroma. No flap is created, and bandage contact lenses are applied post surgery for 4 to 5 days. It's the safest LASIK procedure. Vision recovery is comparatively slow because in this case epithelium is abrasion is done, so that's why vision recovery is comparatively slow than the LASIK. The epithelial abrasion we usually do by manually or alcohol or keratone. Reepithelialization takes some time, so that's why vision recovery is slow. PRK, there are different types like manual PRK, that is manual removal of epithelium with hockey knife, brush or sponge, and epiLASIK, the epithelial flap is cut and put back after ablation. And there is one more procedure called as LASIK. In this, alcohol is used to separate the epithelium from the Bowman's. The epithelium is then pushed away and brought back after ablation. Then transepithelial PRK is also there with the streamlight by means of phototherapeutic keratectomy, and after that excimer ablation is done. There are certain advantages of streamlight. Eye tracker is active throughout the procedure for the uniform ablation. But as in manual PRK, if the patient is poor cooperative, there is chances of mechanical trauma, and that leads to more time consuming. Customized epithelial ablation diameter correlated to the treatment zone. It is an optimized ablation profile in streamlight and can adjust epithelial depth 45 to 65 micron. Software indicates transition from PTK to PRK, and it's visual and audible. There is less incidence of dehydration, and there is no need to recenter the treatment or re-enter patient data. And in this case, procedure time is also less. There are certain advantages of streamlight over manual PRK. In streamlight, there is no mechanical trauma. It's an easy procedure for poor cooperative patient. Alcohol is not used. The eye tracker is active throughout the procedure. It will help for poor cooperative patient. It's a fast procedure time, faster healing time. Even healing of epithelium is faster. Less post-operative pain, less haze. Whereas in standard LASIK corrects moderate to high refractive errors. Up to 11 diopter of myopia and up to 6 diopter, that means minus 11 to plus 6 diopter, can be corrected with standard LASIK. But in this case, flap has to be created. Microkeratome blade is used to create the flap, and laser energy is applied over stroma, and flap is reposited in its normal position. but in this case vision recovery is fast. Usually the numbing drops are applied to the eyes. There is no need of any injection or anesthesia. When incision is made creating a corneal flap, examiner laser reshapes the cornea and the incision heals on its own. The surgeon holds back the hinged flap to access the underlying cornea called the stroma and removes some corneal tissue using an examiner laser. Examiner laser creates a full ultraviolet light beam to remove or ablate microscopic amounts of tissue from the cornea to reshape it. So light entering the eye focuses more accurately on the retina for improved vision. For nearsighted people, the goal is to flatten the cornea, and with far-sighted people, the steeper cornea is desired. Examiner laser also can correct astigmatism by smoothing or an irregular cornea into a more normal shape. After the laser ablation reshapes the cornea, the flap is then laid back in place, covering the area where the corneal tissue was removed. The flap seals to the underlying cornea during the healing period following surgery. Then there are other procedures like femtosecond LASIK. In this case, all grades of refractive errors can be corrected by this procedure. Patient with thinner cornea may be considered for this procedure. Here also flap is created, but with the help of laser energy instead of keratome. Laser energy is applied to stroma, a more sophisticated procedure, but it's costlier than standard LASIK and PRK. And vision recovery is also fast and good. Then one more procedure is there that is called a SMILE, that is small incision lenticle extraction. In LASIK, the incision size is around 20 millimeter, but in SMILE it is just 4 millimeter. And SMILE it's called as a minimally invasive surgery. A small piece of corneal tissue or lenticle and a small incision are created inside the cornea using a femtosecond laser. The lenticle is removed through a tiny opening with minimal disruption to the corneal biomechanics. Removing the lenticle changes the shape of the cornea, thereby correcting the refractive error. These are the latest advancements in laser vision correction, minimally invasive with only a small incision. There are certain advantages of Select Smile. There is no flap complications, better preserved nerves, but disadvantage is that it's costly. There is no treatment for hyperopia, and its procedure is quite difficult. After the surgery, post LASIK, what are the precautions? What are the instructions actually? So rest is must. In mild burning or itching sensation may be experienced temporarily. Eyesight should stabilize and continue to improve within a few days. Avoid strenuous exercise for at least a week. Avoid rubbing the eyes. Avoid head bath for a week. So there are some questions. My age is 32 male. If I go for LASIK at this age to avoid using specs, then for how many years can I expect this LASIK to work? Till what age? So actually, once the LASIK is done, 32 is the ideal age basically. So there are no contraindications. Only thing is that we need to evaluate. But once LASIK is done, so 100%, 99% your vision for distant vision it is permanently gone. But there are chances of getting spectacle for near vision after 40 years of age. Another question: what are the side effects and risks involved in LASIK surgery? What is the success percentage? So the success percentage is almost 100%. Side effects, I was coming to that only. Uh, there are some people they have night driving problems related to abrasions. Also, if you are sensitive to sunlight after LASIK, eyeglasses with photochromatic lenses can reduce photophobia for clearer or more comfortable vision. But LASIK has an excellent safety profile. Still, LASIK complications can occur. These include infection and night glare. A small percentage of people will need a LASIK enhancement or touch-up procedure a few months after the primary LASIK surgery to achieve acceptable visual acuity. You also may still need reading glasses once you reach. That is the answer for question previous question. So you may also need still need reading glasses once you reach your 40s due to a normal age-related loss of near vision called presbyopia. While LASIK surgery has a high success rate, it is important that you discuss with your ophthalmologist or surgeon any concern you may have before you consent to having the surgery. How long does LASIK surgery last? I heard some saying that 10 years, some says permanent for -5 power. Is it possible to take surgery? Absolutely, actually, for -5 power, LASIK is recommended, and the surgery it's last actually the visual recovery is permanent only. So as I said, for distant vision, actually you won't require any glasses unless and until means after 40 years you might require glasses for reading purpose, and after in as age advances you might have there are chances of getting cataract and other problems. So for that in that case vision might deteriorate. But for that also there are treatment options are there. And one more question. I have high power +9 in both eyes with minus 0.75 cylinder and 180 axis. Am I eligible for laser? If my cornea is also thin, how much can it be there minimum and what are the future challenges? So for that actually you need to consult your ophthalmologist, and we do your evaluation with the topography. Cornea thickness ideally it should be more than 500 microns. And yeah, if the corneal thickness is more and rest of the parameters are good, your retina is also there is no problem, so we can go ahead with the surgery. Till what age a person can go for LASIK laser? How many days will it take? It usually takes 2 to 3 days to regain vision, normal vision without specs, and there is no age bar as such, because as I said there are now latest procedures for presbyopia also, for near vision also we can do press beyond. So anyone who wants to get rid of glasses, so any age we can do surgery, provided you don't have any other complications like cataract or any retina problem, glaucoma, diabetic retinopathy. If your eyes are normal, then you can go ahead with surgery at any age. How to choose the type of laser eye surgery for a certain person? Well, that depends on your evaluation. So thorough evaluation is important before going for LASIK surgery. Once we do evaluation, we tell you the uh, uh, options for LASIK surgery. Hi doctor, I have minus 1.75 sight in both eye. Can I opt for LASIK? Yes, yes, you can. Actually, it's very safe for you, and there are 100% chances of you becoming spectacle free. If my cornea is perfect for the eye surgery, some suggested advanced smile pro and some suggested contura. So which one should I go for? My number approximately 7.5 and 8.5. So kindly suggest. Okay. So again, it depends on your thorough evaluation. Definitely, advanced smile and contour we can do, but only disadvantage is it's a costlier procedure. If normal LASIK is possible for you, you can go for normal LASIK also. It depends on your corneal thickness and topography evaluation. What can go wrong during LASIK surgery? What are side effects of surgery? There are hardly any side effects actually. So during surgery, if, during surgery there are no chances of any complications. Only after surgery there are chances of some infection, but that are only point not 1% you can say. It's very less chances. I have both near and far vision can both be corrected with the surgery. Yeah, there is a treatment called as Praise Beyond. With that, your near and distance vision both can go. Same question. I am having bifocal number. A little cataract has also been detected. Can I go? Yeah, but if cataract has been detected, so better not go for LASIK or refractive surgery. So better go for cataract surgery, and in that case, we can implant trifocal or multifocal lens so that you won't require glasses for distant as well as near throughout your life. I am 40 years old and I want to LASIK for my distant vision. Can I go for the same? Yeah, it depends on your number. If your number is high, and if you want to get rid of your distant vision, we can very well go ahead with the LASIK surgery. What are the precautions we have to take after surgery? And is there any chance to get back eyesight after even after surgery? Yeah, actually we do surgery to regain your sight without spectacle. So there are precautions like don't rub your eyes, don't wear glasses for 2 3 days, don't take head bath. So that actually we explain everything after surgery. Is LASIK surgery long lasting? For both the eyes, it takes around 10 to 15 minutes. So it's not that way. It's not a long lasting surgery. What are the latest techniques of LASIK available for 40 plus age group? Specifically asking for myopia. Is contour vision LASIK better in case of 40 plus individual? So contour is not related to age as such. Contour is a different technique which takes care of abrasions also. But 40 plus age group, so if you have distance vision also and near vision also, na, so better to go for Praise Beyond. Can a person who has undergone retinal detachment surgery at the age of 24 can undergo LASIK surgery after 10 years for myopic correction? So it depends on your number basically, and again thorough evaluation of retina. If there are some breaks or if retina is settled, we can consider, but again it depends on your corneal thickness and number is more. So in that case, and which retinal surgery you have undergone, that also matters, whether it is scleral buckling or plain vitrectomy with silicone oil or gas like that. So it depends actually. So there are 50-50 chances you can see. How long number has to be stable in order to have surgery? At least 6 months. Can retinal detachment patient undergo LASIK? I already answered that question. How safe is LASIK surgery? Yeah, it's very safe. Is LASIK surgery effective for improving the cylindrical -5 and +2 in both eye sides? Yes, yes. Even cylindrical number can go, but we need to evaluate it with the topography. Most of the times, if patient has cylindrical numbers, so there are chances of keratoconus or keratoglobus, so that we need to rule out that. What are the precautions we have to take after surgery, and is there any chance to get back eyesight even after surgery? Yeah, there is 100% chance to get back sight after surgery. The precautions I have already mentioned. Minimum age for surgery for children 18 plus. So we recommend uh, uh, surgery to undergo LASIK surgery after 18 years of age. And the second criteria is your number should be stable at least for 6 months after 18 years also. We are okay. So actually, post-operatively, we need to take some medications like antibiotics and steroids. And there is another procedure called as implantable phakic contact lenses, that is ICL, which is 100% biocompatible soft flexible gel lens for polymer. In patients where LASIK is not possible and number is very high, so we can go ahead with this surgery. And usually there are follow-up visits after LASIK surgery, post-op 1 day, post-op 7 day, and post-op 1 month follow-up. Maximum patient can resume office work after 5 days post-surgery. This is a question frequently asked. So I'll enumerate post-LASIK instructions again because many people ask these questions. Mild or moderate tearing from both eyes is common and can differ from one eye to the other on the day of treatment. Foreign body sensation or irritation in the eyes can happen. Occasional appearance of small red spots on the white surface of both the eyes and sensitivity to bright light, hazy vision on the day of treatment. Patient should instill eye drops according to the prescription. Patient should clean eyelid margins from day after treatment with sterile tissues. Patient can have normal food. Then don't expose eyes to dust and don't touch or rub the eyes. Don't take head bath or splash water into the eye and face for 2 weeks. And do not keep eyes open for long duration. Do not clean the eye on the day of treatment. So lastly, there are many machines, but most of them are similar, and a good outcome depends on understanding the machine you have. There are various models actually. There are various companies also, but again depends on your evaluation. Basic LASIK actually is the most commonly done procedure, and sometimes PRK also. So nowadays there are different procedures like Femto, Contura, but they are very cost effective. They are costlier one. So 90% patients undergo PRK and LASIK. It's a very safe procedure, but you consult ophthalmologist, eye specialist, uh, wherever you are going to take treatment. Thank you for patience listening. If anyone still has any question, they can ask. They can write in the chat box. Apurva, Pankaj, can we end? So the one more question, I want to know if I am eligible for LASIK at the age of 41 years. Yeah, you can, depends actually what number you have. Yeah, I think it's done. Thank you very much. Thank you all panelists and all